Hello, NWN community. My name is Millie Isaac Ironondu, and today I'll be sensitizing us on cholera. Of course, we know that there's been a cholera outbreak in Nigeria. It's no news, and Lagos is one of the centers that bears the crux of this cholera outbreak. I also want to say thank you for this opportunity to be able to sensitize the community about this. All right. So currently, Nigeria is experiencing a significant cholera outbreak, and this outbreak started in June, early this month. And currently, the NCDC has reported 1,141 suspected cases and 30 deaths across 96 local government areas in 30 states. And Lagos, of course, is one of the centers. So for Lagos, currently there are 350 suspected cases across 29 wards in Lagos. 17 cases have been confirmed already, and then 15 deaths have also occurred. And the Lagos government actions, some of the things they've done, they've issued health warnings, they've emphasized the importance of hygiene and prompt medical treatment. So this is the situation in Lagos. So let's get into what cholera is in itself. Cholera is a severe diarrhea infection that is caused by Vibrio cholerae. It's a bacterial infection, right? And some of the symptoms include profuse watery diarrhea, vomiting, rapid dehydration, muscle cramps, weakness, low blood pressure, and in severe cases can actually lead to death, can also lead to renal failure if left untreated. So we see that this is not a child's play. It's serious. It's a serious public health issue this period. So how does cholera spread? Cholera, cholera spreads through contaminated water or food, poor sanitation, for example, open defecation, contaminated water sources. And we know that where we live, Lagos, is a dirty man's land. It's very dirty. A lot of places are very dirty. We see a lot of contaminated water sources. We see open defecation. So it's not far from us, right? So it's easy to spread in Lagos. Also, consuming raw or undercooked seafoods, hygiene factors, unclean hands during food preparation or consumption, inadequate waste disposal as well, right? So these are some of the ways cholera is transmitted. So how do we prevent cholera from spreading? Of course, when we know the modes of transmission, we also know how to prevent its spread. So for water, you have to make sure that your water is safe enough for drinking. And how do you do that? Boil your water. If you have access to chlorine, treat your water with chlorine. Filter your water also. There are filtering equipment that can be used to filter your water. So boil, treat with chlorine, filter. But boiling is also very, very advisable. If you can boil that, that's fine. Then for sanitation, make sure that you exercise proper hand washing. Practice proper hand washing. After using the restroom, make sure that you properly wash your hands with soap and running water, right? Also, make sure that your waste are properly disposed. Kitchen waste, household waste, make sure that they are properly disposed. Okay, then for your food safety, I would encourage that you thoroughly cook your food. If you can cook in your house, it's more advisable this period than buying stuff outside if you can, right? But if you cannot, of course, make sure that where you're buying from is safe and they practice good hygiene, right? Make sure that your fruits and vegetables that are bought are properly cleaned before consumption. Yeah. So for someone who has been infected with cholera, what are some of the responses that we can give? So of course, when someone is down with cholera, the first point of action is to go to the hospital, seek medical help, right? Go to the hospital. If you have access to medical help immediately, please seek it immediately. Then we also have what we call oral rehydration solution. That's your popular ORS to prevent dehydration. When someone is stooling and vomiting at the same time, there's a high tendency of dehydration. So ORS would help in rehydrating such person. And ORS is a mixture of water, glucose, and salt solution. And the person takes it throughout the day slowly. Right. Then also, we also encourage isolation and hygienic practices. For someone who has the symptoms of cholera, we encourage that they are isolated to prevent transmission from others. I mean, isolated in the sense that you prevent contact with other people or food. Don't allow them cook. Don't allow them tamper with things that you know are stuff that can cause transmission. That can cause transmission. Then also practice strict hygiene. Make sure that they are always washing their hands with soap and running water. Make sure that they are they practice general hygiene, the normal hygiene. Yeah. So why is proper sanitation and hygiene very important? Of course, even before this cholera outbreak, we know that hygiene is important. It is very important. But because of this cholera outbreak that just recently happened, we are now emphasizing it the more because proper sanitation and hygiene will help in preventing contamination. So we encourage that people drink safe water, which I've explained before. You drink safe water by boiling. So when you drink this water, you don't have any cause to be infected because your water is safe, your food is safe. Okay. Then also, it also helps in reducing the spread of cholera. Good hygiene practices like hand washing with soap will help you prevent the spread of cholera from person to person. Then, of course, we cannot also overemphasize the importance of proper sanitation infrastructure. Make sure that you can access a functional sewage system. It's advisable. Then also, as much as you can do, maintain a clean environment. A clean environment would help you to prevent contamination and spread of cholera. Once again, my name is Millie Isaac Ronaldo, and I'm from Navigating with Mel Community. Thank you so much for the opportunity and thank you for listening to my chat. Bye.